I'm sure people watching this program now have seen either documentaries or news footage of some safe, what do you call it? I called it injection, but you call it safe consumption sites, which are frightening to look at because there are some of the most vulnerable people in our society in these sites who look like they are doing significant harm to themselves. And if you're not a professional and you're looking at it with a layperson's eyes, you are thinking, what in heaven's name is going on here? Mm-hmm. So give us a better understanding of why you really believe that's the way to go.
I guess I'll start by saying one thing. We are losing 7 people every single day in this province to preventable, accidental toxicities from drug use. I'm really afraid we're forgetting those numbers and we're getting used to that being a reality. And I'm not comfortable with that being a reality. We need to find ways to prevent these deaths. And so what these sites are doing is providing a way for people to stay safe when using drugs. And I think I would urge people to think about the alternative. If you don't have community-based programs with people who are there to help support people who use drugs to keep them safe while using drugs, but also they play a really pivotal role in connecting people to other services within their community. If you take that away, it's not going to stop people from using drugs. It's going to push them into hiding that drug use, using in other public spaces, not being able to discard of the things that they are using, the equipment that they're using when using drugs in a safe way. There are all these other implications. I think sometimes people assume that if these go away, people will just stop using drugs. We're just helping people use drugs. People aren't going to stop using drugs. We've used drugs for centuries. It's not going to change the pattern of substance use. It's going to change where it happens. It's going to decrease the safety of people who are using drugs. And it's also going to really impact communities because we won't have a safe space to coordinate care and to help support people within these communities who are using drugs.
In which case, in our last 30 seconds, there's every likelihood somebody from the Ministry of Health or from the mental health and addictions part of the ministry we'll get a transcript of this interview, and you can give them some free advice right now. What do they need to do?
First of all, recognize the urgency of how many people are dying and do that publicly and use that to inform your decisions. And secondly, and I know this is a hard ask, but take the politics out of this. There is clear evidence around how we can keep providing evidence-based treatment and doing it in a really, really well-adapted way to people's needs. And there's really clear evidence around the benefits of various harm reduction programs like safe consumption sites and safer supply programs. So rely on the evidence, engage with communities, find out what they need and how you can help financially support the investments needed to put in place those various different evidence-based programs within the communities that need them.